Okay, so in your UK MLA or PLAB 2 exam, you're going to face some really tough scenarios. And today, we're tackling one of the most critical ones you could get, how to handle a patient disclosing a sexual assault. We're going to break it down so you can manage it with real skill and compassion. Welcome to this clinical walkthrough on the sexual assault disclosure case for UK MLA, brought to you by Mediate, your 24/7 practice partner. Our goal here is to make sure you feel confident and prepared to handle this scenario with the compassion it really requires. Right, so we've broken this entire consultation down into 6 key stages. We're going to walk through every single one, starting from the moment the patient walks in, all the way to that crucial safety netting at the end to make sure they're supported. Okay, let's dive in. First up, setting the scene. Your assessment starts before you even walk into that room. That little bit of info you get at the beginning, it sets the entire tone for the consultation. So here's the setup. You've got a 19-year-old male university student. He's in a GP clinic, and all he's asking for is a sick note. But look at his demeanor. He's tense, he's fidgeting, he can't make eye contact. That right there tells you there's probably a lot more going on under the surface. This is your very first clue that you need to be sensitive and start asking those good, open questions. And those observations you just made, they lead us perfectly into our next phase, building rapport and trust. Honestly, this is where your communication skills are really put to the test. So the patient says something like this. He's clearly deflecting, right? He uses these vague words like stress, and he's trying to shut you down. This is such a classic sign of someone who's really struggling, but just isn't ready to talk about it yet. Your job here isn't to push for an answer. It's to create a space that feels safe enough for him to talk if he wants to. So how do you actually do that? Well, there are 3 key steps. First, stick to open questions. Something like, can you tell me a little more about what's been going on? Second, you've got to validate his feelings. Even a simple, that sounds really stressful, can make a huge difference. And third, and this is so important, you have to explicitly reassure him that this conversation is confidential. That combination, that can be the very key that helps him open up. Okay, and if you do all that right, it can lead to this, the pivotal moment of the entire consultation, the disclosure itself. And I'm not exaggerating when I say your response in the next few seconds can make or break the entire therapeutic relationship. He trusts you enough to say it. This is a huge turning point. Your reaction now is absolutely everything. So what's the very first thing you do? Nothing. Before you say a single word, just pause. Take a breath. Let what he said sink in. That pause shows you're actually listening, and it gives you a second to form a thoughtful, empathetic response, not just a knee-jerk reaction. And this right here is pretty much the golden phrase. Let's break down why it's so good. I'm really sorry to hear that. That's pure empathy. That must have been incredibly difficult. That validates his experience. And thank you for trusting me. That acknowledges just how much courage it took to say that. It's non-judgmental, it's supportive, it's exactly what you need to say in this moment. Okay, so you've handled the disclosure with care. Now we need to move into the history taking. The goal here is a tricky one. You need to be structured and get the info you need, but you absolutely cannot be intrusive or re-traumatize the patient. So first, you need to gently ask about the event itself. Questions about when it happened, where, who is involved, they're really important for medical and forensic reasons. But the way you ask them has to be incredibly sensitive and patient-centered. Next, you have to assess the immediate impact. Has he talked to anyone else? Is he safe right now? And crucially, how is this affecting him mentally? You need to ask about sleep, concentration, and listen. The question about self-harm is absolutely non-negotiable. You have to ask it directly. It's a key part of your risk assessment to keep him safe. All right, once you have the necessary history, the whole focus of the consultation shifts. Now it's all about management and support. Your job is to empower the patient by laying out his options clearly and without pressure. And this is so important for defining the roles here. It's on you, the doctor, to clearly state that what happened was a crime, but it's entirely the patient's choice whether to report it. There's no time limit, there's no pressure. You're simply there to provide clear, non-judgmental information and support, whatever he decides. Okay, now one of the most important things you can offer is information about a SARC, a Sexual Assault Referral Center. For your exam, you absolutely have to know what this is. Think of it as a specialist, one-stop shop that provides confidential support for survivors. And look at what a SARC offers. You need to explain that the patient is in total control here. They can go to a SARC just for medical care, like STI screening, or for counseling, and never, ever, ever involve the police if they don't want to. They can even have forensic evidence collected and stored, which buys them time to decide what to do next. And knowing these steps is one thing, but actually doing them under exam pressure is something else entirely. You can practice this exact case right now. Get objective feedback on mymediate.com. Okay, we're moving into our final and absolutely critical section, closure and safety net. How you end this consultation is just as important as how you started it. You want to leave the patient feeling safe, supported, and with a really clear plan in their hands. So here are 3 concrete things you have to do before he leaves. 1. Give him that sick note he came for, but word it discreetly, something like unfit for study for medical reasons. 2. Tell him you'll be discussing his case confidentially, of course, with a senior colleague just to make sure he's getting the absolute best care. And 3. Book a specific follow-up appointment. That gives him a clear, concrete safety net. Look, through all of these steps from the very beginning to the very end, please remember your number 1 priority. It's not about procedures or referrals. The single most important thing you can do is make this patient feel that they are believed, that their experience is valid, and that they are supported. So that wraps up our walkthrough. I want to leave you with a question to think about. When you really internalize these steps, a scenario that feels incredibly daunting becomes manageable. And that's what allows you to provide the kind of excellent, compassionate care that every patient in this situation deserves.
Thank you for joining this walkthrough. To put this all into action, you can practice this exact case now on mymediate.com.